Tēnā koutou katoa. I bring you stories from the dark side of social services. So, in May 2014, then Minister Tariana Turia wrote an introduction to a publication regarding social services performance, and she kicked it off with saying that the Crown has spent 30 years delivering mainstream social services to particular families, and they have not made one iota of difference, which is fairly in the teeth kind of stuff. And she's not alone. In fact, I think that attitude is representative of this government's take on the performance of the sector. The social services sector delivers 10% of all hours worked in New Zealand, and our economic activity is 5.9% of GDP as at 2009. Yet there is no data. No one knows who is getting the help, or how the help is deployed, or the characteristics of high users. And according to Gluckman in 2009, we do not know what works, and even when we think we do, we struggle to replicate it. In the last 6 years, we've had falling funding in real terms, funding from my very parochial viewpoint moving north, and significant cuts in some funding streams. Since the end of 2012, Minister English, who will be speaking here this afternoon, has been talking about significantly reducing the number of social service agencies, perhaps as much as a 40 to 50% cut. We've seen the Green and White Paper on vulnerable children, which has strongly suggested a massive narrowing of the client group, down to perhaps as little as the most needy 60 to 70,000 children. Minister English again has been talking about big data in the sector. We've had the Productivity Commission, who we heard from this morning. We've got the Social Investment Strategy, Superu moving into monitoring and accreditation space, the Children's Commissioner report into SIFS, and the SIFS Expert Advisory Panel review as well. And not much of that is saying good things about the current state of the sector. Organisations are starting to falter and close at far faster rates than normal. And in my market, we've seen Kapapa Māori, disability and general social services closing. Nationwide, it seems like a similar story. Oh, I think we're on the... I'm going to need to scoot ahead because I changed the order. There we go. Plus, there are the long-standing challenges that we all know about, but I'm going to recite here so that we can all feel truly depressed before I get to the hopefully good news, okay? So, funder expectations, and like many of you, I can see some people with grey hair, like myself, who've been doing this for 20, 30 years. Yes, since the 1980s, we've had the government implement a social services market with lots of small providers competing with each other for fixed funds over short periods. It's fragmented the industry. It's prevented economies of scale, and it's suppressed wages and innovation. The lack of standardised quality assurance requirements has fundamentally meant that nobody is in charge of the quality of the work that we do. We've got a front line about which there are emerging concerns in terms of the quality of our social services workforce, and the Productivity Commission's report, but particularly the Children's Commissioner's review into SIFS, raised some significant questions. Current workforce training relies upon a number of concepts that have either not been adequately tested or for which there is best contradictory research, and I'll say some heretical things about holistic practice in a few minutes. And in early childhood, which we also deliver in, things like child-led delivery, from which the research coming in now 40 years after implementation shows that it produces worse outcomes than no early childhood education at all, but it is a dominant paradigm being taught to our ECE teaching workforce. We've got leadership issues, and I will absolutely cop to this. We've got low wages, a fragmented and contradictory nature of contracting across funding silos, lack of resources, inwardly focused workforce. You know, it just doesn't incentivise for strategic leadership in the workforce. And we've got a problem with the state of our art. Until quite recently, there has been very little in the way of evidence-based research as to what actually works. And if it has been created, it hasn't seemed to permeate the industry. And until recently, and I'm a big PCOMS fan, until recently with tools like PCOMS, it just has not been possible to know what the impact is, what is making the difference. So that's the outside of the story. The inside has been just as challenging. For us, it's been a bit like driving off a cliff, hoping that we could sew the parachute together on the way down. 2007, we didn't know, which is when our journey started, we didn't know if our work had any real impact for those we worked with. We didn't know what we wanted to achieve as an organisation. We had no tools to support staff performance, no financial controls or modelling or policy manual, and our IT system was literally held together by tape and constituted a health and safety hazard. And we raved to anybody we met about how strengths-based we were and how we were so good at what we did, all the while producing what in hindsight can best be described as incredibly average work. So our solution was, because we could see some of the storm clouds on the horizon and we were hoping to evolve quite rapidly, preferably straight from gills to opposable thumbs without doing too much of the intervening mucky bit, was to recreate the mission while leaning on income from our endowments. And we're in the very fortunate position of having millions of dollars worth of endowments. It's one of the benefits, I think, of being an old organisation. You accrete resources. And while we invested in ourselves and the work, and about 6 months after we decided to do that, the global financial crisis hit. Wiped $1 million off the value of our investments and halved the return that we were getting from it. So our economic base for a change, radical change that we had just started, disappeared, and we were faced with the very complex decision about whether to continue or to stop. Much aided by the realisation that if we stopped we would have to close, because normally what you'd do as a manager is you'd cut all the excess off, you'd get down to the good muscle and the bone and you'd rebuild. We had no muscle. We had very little bone. So it was either plough on or wind up. The change, I'll tell you now, has cost us around $700,000 over 6 years. That's the bad news. The good news is we probably did it the most expensive way possible, and you can learn from us. Okay? But fundamentally what that represents is that we bet the farm on changing. Yep, once you started, there's no stopping. The first work for us was to cut the dead wood, and between 2008 and 2014, the mission's turnover shrunk by 1/3 in real terms as we did that. Much of that was closing service that weren't us, because we wound up working out who we were when we got up in the morning, or that just didn't work. For a while there, we were running a cafe for people who living marginal street lives in a shopping mall that had no destination traffic and no pedestrian flow. So there's been some poor decision making. Yeah, some of it was because we couldn't fix things in time. Out of the blue, government policy changes cost us over $500,000 in income in the last 2 years alone. These were changes that closed other agencies, often with only weeks of notice, including the largest kaupapa Māori private training establishment in Auckland. Yeah, so we have been fortunate to get through. And the mission lost staff again when we implemented our strengths-based engagement model, which we call Quality Works. And of course, while we were changing, so were the demands on us from clients, because they too were experiencing the GFC, and funding did not keep up. We were repeatedly told, like I assume you all have been told, to do more with less, often in tones of great impatience and frustration by the funder agent. So actually it's been a lot like driving off a cliff. And implementation, there we are. I hope you've all been introduced to the face palm. We made a lot of mistakes. I couldn't find a GIF with a woman in it with a double face palm, but I think that's probably more applicable. When we implemented with our social work team, which was our first rollout, and we started that 6 years ago, it took us 3 years to get to good data. Our first mistake, we built it as we went. We didn't implement KPIs for the first year, or electronic monitoring, data collection and crunching, for 2 years. It took us another 6 months after that to build the bit of the engine that could spot the garbage in, garbage out data sausage factory stuff, of which it turned out, there was quite a lot. The gap between the say and the do of our staff, we discovered, was quite wide. We'd ask, they'd said, yes, I'm doing it. When we went and checked, it turned out they weren't. Now, it's not that they were lying to us. I want to be really clear about this. This is good people who were doing their best. They just didn't believe in what we thought we knew. And so they were continuing to do what they believed was the best work possible, and treating what we were asking as an add-on that could be ignored. And because we had built it as we were going and stuff didn't come on stream for 2 to 3 years into the process, we actually had no way of catching that in a reasonable time frame that left us room to coach and to monitor them and to coach again, yes, and to tap, you know, that constant little, it's a bit like Skondo. You've got to keep tapping it to keep the shape, yeah? We weren't doing that. We'd find out 6 months after we'd had promises from them, and then we'd turn up and be quite grumpy, and it really wasn't a good look. So we had to implement a whole lot of professional practice tools along the way. Embedded client plans, embedded assessment and formulation, a completely new case review model, and a radically revised recruitment and induction model for staff. But our biggest challenge was this. Workers were used to holistic practice based on philosophical models of power and inquiry, and most of all, of relying on their gut. Because most of our workforce was in their late 30s or older, so they had over half a decade and a half, 15 years, probably about average, built to those touchstones. They'd had to rely on their intuition because there were no other tools available. When we turned up with tools, they found that threatening. Our new tools were not based on philosophical models of empowering inquiry. They were based on evidence. International evidence, research into what actually works in practice, and we had learnt some deeply uncomfortable things. We had learnt that 90% of below average practitioners, and this is true in medicine, judiciary, management and counselling, rate themselves as above average. Worker report of their efficacy is near worthless. That means relying on your gut is wrong. It's more likely to produce a false positive or a false negative than it is to provide something that is true. Even good practitioners struggle to accurately identify when clients are deteriorating. Of the factors for successful change, the vast majority of them lie within the client's reach. The worker is not the hero and does not fix anything. If change is going to occur, it will show up early within the first 3 to 6 sessions. Holistic practice does not work. Excuse me. It is deficit-based, talks all about the problems, and it often, the only success it has is to trap the whānau in their list of failures. Yeah? Building a trusting relationship, and I don't know how often you hear this, but I hear this a lot. I've got to build a relationship with them first before we can do the work. May actually hurt the chances of a good outcome. You know, one of our big learnings is the clients think of us as the plumber. They'll like us after we fix the toilet. Yes? It's a conditional respect. It's conditional upon us doing good work, not the other way round. And we also learnt that measuring the client's estimate, not the workers, of how they are doing is highly valid, as is measuring the client's experience of their alliance with the practitioner. So you can imagine how that went down. Really badly. You know, the workforce experienced it as an existential challenge. We thought it was a fantastic discovery, turned up and said, guess what, we've learnt. And they heard, you hate me, I'm going down the garden to eat worms. And there were endless conversations about social work ethics and the safety of sorry, I've just been locked out, isn't that fun? Of staff. And I'd say things like, you know, we're going to look at this and we're going to look at that and we're going to look at the other, and they'd say, this breaches my social work ethics. And I'd say, oh, that's very interesting. What part of your social work ethics? Just my ethics. That's cool. I can't engage with that discussion until you can tell me specifically what your concern is. I don't feel safe. Okay, well, so you can imagine, it got very complicated. But the mission has a long-standing understanding of the hierarchy of stakeholders in our world, and we're really clear about this. Clients come first. If it works for the clients, and I don't mean in the individual, I mean in the aggregate, if it works for the clients in terms of what the research tells us, we will look to do it. Staff come last. They're still important, we care about them, we'll do our best, but if you're asking us to pick between one of those two groups, we will not pick the staff. And somewhere in the middle of those two become the funders, because of course we cannot hire staff without funder support. You know, they are going to outrank the staff. And of course our parent body, the Methodist Church of New Zealand, who sets our philosophical and theological direction. When we finally got the monitoring right, 3/4 of our social workers left within a 6-month period. There may even have been lawyers. We felt bruised. The staff felt bruised. But we learnt. We learnt an awful lot from that. And when it came to making similar radical changes with our early childhood education team, it took 2 months. 9 months later, all of our staff are still there. They are ambassadors for the change and they are loving it. So I suppose my big message to you here is learn from us. There are better ways of doing this. Okay, so success. Terms and conditions apply. Okay. So the journey for the first implementation does sound pretty awful, and it truly was. It tested everybody involved, and I'm very happy to say that of all of the social workers who quit or left, they all got jobs within weeks of departing. And we were able to hire new staff within weeks of their departure, all of whom embraced the new models just as being a standard part of their new workplace. And to my absolute amazement, the most vociferously opposed staff member who left during the change process now works in an agency where she thinks it's fantastic. They've got all this electronic quality assurance stuff tracking the client's experience of the work. Yes, Harvard Business Review says that cultural change in organisations takes 5 years, largely because that's the amount of time it takes for the old guard to flush out and the new guard to flush in. Yeah? And I suppose one of our learnings has been is you can hasten that process. So, but the clients come first. We're in this work to help them have a different experience of their lives. I will absolutely put them ahead of the workforce every time. And my recommendation to you, you do that too. Okay, so awful stories, yet. We met the objectives of our 2008-13 strategic plan, and we're using advanced business tools to do it. We've completed 2 major research projects, and we've now been invited to undertake another one into ECE uptake in South Otago. We run 2 major new services based on sites in early years, Service Hub and a family support centre. We've picked up parenting through separation, incredible years, and an independent advocacy service on the way. We are the provider of choice in our region for corrections parenting programs and are piloting innovative literacy programs with them. We've got joint relationships with rural-based health providers for social services provision in their communities, and we have a close relationship with 2 iwi-based providers that I'm very proud of. We've completed 2 innovative community building programs, and we've got an extension to a 3rd, and we've given free ICT consultancy to nearly a dozen NGOs, and our IT system is class leading. We've gone from a minimum of 13 sessions per client to an average 3.2. For the first reason for service, and 2 sessions for the second reason. Intake scores, which is for us, we think of it as a measure of resiliency, are higher when they come in the second time than when they came in the first time. Yeah? So we're a social service agency that's interested in social justice and social change. For us, the target is not that bad things happen or do not happen for the clients. It is that they can deal with it without agency intervention. Yeah? So our target is that people exit service with us more able than when they entered the service provision. Yeah? The changes are less worker and client time per outcome, less overall duration of service per outcome, less likelihood of dependency on us as a provider, and we spend a lot less time on clinical management of staff, because the staff can see how they're doing too. So instead of doing a kind of fortnightly internal clinical supervision with staff where we have to hear all the stories to figure out what it is we want to talk about, they arrive knowing that it's this client, that session. Yeah. We can and have intervened in workers' practice between the first and second session to achieve a better outcome. Research shows a shift of 15% in the score that we used is statistically significant. We are averaging 22.5%. Change is lasting, it's transferable, and future demand for help is reduced. In early childhood education, intervention is early, well managed and targeted. External resources and internal resources are better targeted to best effect, and we are seeing significant shifts in the readiness of the children that we work with for primary school. And we're growing again. In the last 6 months, we've picked up several $100,000 of additional funding and contract because of the way that we do our work. So here are my learnings. Change takes courage. You begin by starting. Perfect is the enemy of good enough. The greatest challenge comes in the culture of the organisation and particularly in leadership. And we talk about productivity a lot in New Zealand. Productivity comes from management, not from the front line. Productivity is about how you arrange the work, the conditions you set for the work, how you resource that, how you coach, how you guide. Management culture has to shift to being achievement-oriented. You have to want to know how you're doing. You have to think that that matters how you're doing. You have to decide that data is your friend, yeah? Not the one ring to rule them all, but the thing that enables you to create the one ring. Once we become achievement-oriented as a leadership, the rest follows. And the work continues. I know that on Monday, when I'm back in the office, Charles, our practice leader, and Dave, our ICT leader, will nobble me on my way in through the front door and say, hey, we've been thinking, we could tweak this, we could shift it, we've been thinking, we've decided, and let's, there'll be something new that we've learned in the last week while I've been away bouncing around doing these sorts of things. Yes? And that is the best change of all. This is not a journey where there is a destination. Yeah? In 5 years' time, somebody will have something better than the system we're using, and we'll have to find our way to that. Yeah? There's not a target to hit. It's a journey, but it's a journey where if you paddle faster, you get to cooler places sooner. Thank you for your time.
We've got some 3 or 4 minutes for some questions if anyone would like to ask for something specific. And some people with roving mics to come and bring it to you.
We've got 3 or 4 minutes for questions, and there's roving mics, so if anybody would like to ask a question, put your hand up. Any takers?
No, it's fantastic. We can all get more coffee.
Hi, are you available to do private tutorials? And I'm serious.
Contact details.
You could actually charge out.
Thank you. Well, my work here is done,
Kia ora. I don't know if I've got the mic, so I'm going to jump in here. I'm interested in the bit that you talked about where you said that potentially building a relationship with a client isn't important to the outcome, or it can be detrimental. And I just wondered if you could talk a little bit about more about that.
Yeah, and we need to be really careful about the word relationship, because one of the things I think happens to it is it becomes a train station. Yes? And the way that we were hearing from our practitioners about a relationship, it was verging on a relationship of affection. I would know all about you, we'd be connected, we'd be bonded. This idea that the relationship would be bonded with each other. And we were hearing from people as I need to spend 4 or 5 sessions with them just to get the relationship in place. Yeah, which is a very, very expensive way of doing something while the client is waiting for us to get on with it. Yeah. Yes, there has to be a relationship, but I think we need to think of it as being much more like an alliance. We are working together on this thing in your life. Yeah? And I think it takes a lot less time to establish an alliance than it does to establish a big R relationship. Our experience has been that we are getting in the first session past the standard presenting issue. Clients turn up with a real thing, but it's a test to see if you're going to actually pay attention to them or engage with them respectfully. Yeah, and the substantive thing that's really getting to them often sits underneath that or behind it. Yeah, we are getting past the presenting issue and into substantial stuff in the first session. So yes, there needs to be an alliance. They need to see that you are somebody that they can respect and that there can be a foundation of trust in the relationship. But that's different from bonding with each other. And so The caution I would offer is this isn't 1950s with consultant doctors turning up and believing they don't need to talk to the patient at all, which used to be the way. But we need to be focused on the work in the relationship that we construct with the people that we are engaging with. And we are the plumber, You don't want, if you've got a broken S-bend on your loo, the plumber to come up and sit down and talk to you for 45 minutes about the upcoming All Black game. Yeah? You want to know that he or she is going to be able to do the work. You need enough of a connection around regarding them well enough to trust them, but that's it. Yeah?
Neat way to sort of listen to someone for 10 minutes and to sort of capture both your enthusiasm and your talent, which if was shared amongst the sector, I'm sure we would paddle faster to better destinations. Can I borrow that? And you spoke about courage being essential, and it's just a matter of starting sometimes.
Yeah.
Can you reflect back, what were those first 2 or 3 starts, or is that too difficult a question to answer? What were those first 2 or 3 things you did?
We started with excitement because prior to the GFC we had a reasonable cash flow coming off investments, and so it felt like a luxurious activity, and so there was the real sense of let's find out what this puppy can do, And after that, it's been pretty much white knuckle all the way. And I remember complaining to a mentor of mine that at any one time in the job, I felt like I only had 80% of the skills to do the job. And she laughed and told me that it was a luxury and gave me the 4 Yorkshiremen sketch from Monty Python. And if you haven't seen it, you need to look it up on YouTube. Yeah. And I think that more than anything, it's that perfect is the enemy of good enough, and you've got to begin by starting. Yes, we often wait until everything's aligned and we've got a really pretty picture, and I don't think that's the point of planning. The point of planning is not to map out the complete journey so there's no spontaneous or surprising moments. The point of planning is so that you can remember at any point in time what it was you thought when you kicked off, and what was important, and what were the conditions for decision making, so that you don't have to remember all of that. It provides a rigour and a discipline. It's not a concrete pair of shoes. So And the nature of change is you're never going to know what it's actually like until you're on the other side of it. Yes? So we cannot wait until things are perfect. That won't work. And we have to accept that there are going to be casualties. Now, we did lose a large chunk of our social work team. We did our damnedest to take care of them through that. We spent a fortune on counselling. Yeah? Special leave days, the whole 9 yards, right? I'm not saying be ungenerous. But if you're going to make these changes, you have to start. You can't wait for it to be right or perfect. And the best place to start, this would be my personal advocacy, is figure out what it means to be your agency. What is the thing that your agency does? It clarified for us. Immediately we decided on our tagline, which is change that works, enough support and challenge for you to risk a better future. The idea that we were a learning agency. People would leave service with more skills when they started. Once we figured that out, that was our unifying thing. Everything tumbled out behind that. Yeah? But no one particular moment, just all of it.
Thank you so much.
Thank you.